Dear friends, we are happy to meet you once again Saturday. Today we have finished 1080 case. So today is Saturday, 18th March 2023. So every day almost we are getting one case of Puberphonia. Here I want to make an announcement also. See, if we are even willing to do Puberphonia treatment at free of cost also, provided they will be able to get the reference from their principal. That is the main thing. If they are able to get a reference from their principal or college or headmaster, we are able to do it freely for students who are having Puberphonia. So this will not only treat them, but bring awareness among other people that Puberphonia can be treated. So, if one boy opted and got trained by us in Puberphonia treatment, then others also will follow in the same line. So, we can eradicate Puberphonia from the world. So, we have come out with a new option that we can do treatment for Puberphonia freely. So that is the information I want to tell the public. Provided they get a written letter from the principal. That means the principal had come to understand this boy is having a childish talk or female type of talk. So this message will spread to all the students. So who are having the Puberphonia voice, they will opt for a treatment and they will come forward. So this apply for all colleges also, even village level also. So they should be able to get a signature. If village boy or village gentleman is having the problem, he should get a letter from Tahsildar or a reputed person. That means we are making the awareness, that's all. Then we can do it freely for them. 5 days, definitely we'll be able to help them. So our aim is we want to eradicate the Puberphonia thoroughly from the world. They can enjoy their talk. And another important feature is Tamil language only taught me how to treat Puberphonia. Tamil words, each and every word is having its own meaning. So it is not just like other languages. Few other languages, even I can say Malayalam and Karnataka, Telugu, all are having the same thing only. See, English letter pronunciation is completely different from what are the letter you are going to write for it. Go means go. But in Tamil language, it is not like that. Each word is having its own meaning. We are not changing the word at all. That is why I am already told you, English is having only 26 letters. But Tamil is not like that. It is having many letters. And many letters are having its own value in it. So I want to repeat, Tamil is having more letters. Even vowels, 12 vowels. But English is having only 5 vowels. Great. And Tamil is having 18 consonants. And then Uirmai Eluthu, another thing. So it will join together and form 247 letters for Tamil. And each letter, I have already told you, each letter is having its own value. That means even if you take consonants, there is Valinam. That means it is coming from chest. Kasadadabara. Mellinam. That means it is coming from the nose. Third thing is Idayinam. That means it is coming from the mouth. So, our Tamil language is a fittest language to treat puberphonia. One small example I can say, which is male voice or low frequency voice. Mo, mo, mo is a low frequency voice. Ki, ki, that is a high frequency voice. So these letters itself give you an indication and treatment for puberphonia for you. If you correctly pronounce and take these letters in your mind, then you can treat puberphonia without any problem at all. Because we know that vocal fold is very important, that is vocal cord for vibration. But the sound track where it is resonated and produced the voice. Larynx vibrate, but resonance is only in the sound tract, supralaryngeal tract. So this is very important for you. Where are the resonance cavities? It may be in the nasal cavity, the pharyngeal cavity, and laryngeal cavity also. Beside that, trachea and other small cavities in the frontal sinus, sphenoid sinuses, maxillary sinus, ethmoid sinus, also some effect on resonance. So this is very, very important to make resonant or revibrate the sound and make it as a rich voice. So that is, so there are, we can calculate, there are 6 resonating areas in our body, that is larynx, pharynx, mouth, that is oral cavity, nasal cavity, upper skull cavity, and the chest. And each words definitely mix with these parts to make a correct resonance. So larynx is also important. We are not saying the larynx is not important, but puberphonia treatment is done at the level of uvula. That is the thing. The main resonator here, what work is pharynx. The pathway between nasal cavity, oral cavity, and laryngeal cavity is pharynx. The amount of resonance produced depends upon how much air passes through the pharynx and what velocity. The soft violet and uvula play a major role in directing the sound energy air into the nose and oral cavity. So while in mouth is an important resonator. So here definitely lower jaw or mandible play a important role. Relaxing the tongue, keeping it flat down in the mouth, keep it to create more spaces and help with tension. Tongue also used to shape the vowels. Shaping your lips will help very much before the sound leaves through the mouth. Definitely the nasal cavity, through the nasal cavity also the sound travel outside. Whether the resonance is big or slow in the nose we can measure. So this is very important about the resonators. Definitely chest also play a important place for resonate. So resonators are upper skull cavity, nasal cavity, oral cavity, pharynx, larynx, and chest. Here, the shape of the vocal tract that is modified and act as a acoustic filter. So the characteristic of each word when it comes out, it is changed according to the action of the filter. So we are now measuring the cavity of the upper respiratory tract with MRI, magnetic resonance imaging. So now we are more interested in doing MRI for most of our patient, which is a great help for us to know what extent we are going to be sure and tell the public how the uvula moves. So, MRI, magnetic resonance imaging, is potentially the best method to study the vocal tract physiology during voice production because it is a non-invasive and absence of ionizing radiation. And it gives the possibility to analyze the entire vocal tract during movement of each of its parts. This, together with the recording of the emitted sound, can provide detailed information on the physiology of speech. Most recent studies have achieved good result in representing the changes in the vocal tract during emission of the vowels in speaking, which require slow movements. With the further development in the MRI is necessary to allow an equally detailed and commercially available study for further movement and particularly in articulation of speaking. MRI of focal drop, although it is a very promising, this subject to the typical limitation in MRI is there, the possibility of performing the examination of the claustrophobic effects. That means patient will be frightened to go into a cave because while doing MRI, it is by magnetic resonance only. So they will be frightened because of the claustrophobic effect. And the metal subjects and medical devices are not compatible with MRI. And it requires absolute collaboration of the patients who should not have dental prostheses, which prevent the MRI result. So it is only little more effort and energy is required for doing more study on MRI and involvement of the pharyngeal resonance, nasal resonance, and sinus resonance in treating puberphonia. The very interesting thing is we are forming few more theories and suggestions because 1963 only Helmholtz put forward the acoustic theory of vowels and showing that the quality of depends upon the resonating character of the vocal tract. 1863 itself. So from there onwards, we are searching the different organs for speech. Whatever may be, everyone feels larynx is the organ for speech. Now, we are not thinking like that. There are 7 organs for speech. That are all tongue, upper lip, lower lip, upper tooth, upper gum ridge, that is called alveolar ridge, hard palate, the soft palate, otherwise called as velum, the uvula, which is hanging at the end of the soft palate, the pharyngeal wall, the glottis, the space between the vocal cord. Because now we are not only thinking larynx is the voice box. No. Speech production, there are 4 processes for speech production that everybody knows. The initiation from the lungs, what diaphragm moves. Second thing is phonation. Third thing is oronasal process. The air goes and come out through the mouth or it comes out through the nose. And the last one is articulation. So there are 4 processes for speech production, which is initiation, phonation, oronasal process, and articulation. All these things can be measured by MRI, by a simple non-invasive procedure. What a good. So a recording of speech sound and articulation with MRI, we can form a chart. So this is a very good thing because the sound you need not hear. you can see the sound. What a wonderful thing. You may think as a synesthesia. So we can find out how you normally breathe and taking a deep breath while speaking. Action takes place in the chest. Puff out of your shoulder raise when you can breathe shallowly from the chest rather than deep and down. This will result in a breathy or weak voice. But you have to take a second thing is take a deep breath. Deep breath of air should go deep down to your belly. If your stomach or abdomen expand and contract with your breath, you are breathing the correct way from the diaphragm. You can compare speaking while breathing from the chest and breathing from the diaphragm. As you push the air through your mask, your voice becomes louder and much more robust with the diaphragm breathing. Then you can speak loudly and possibly without straining your throat. And the vocal cord straining is least. Many people used to tell, I'm shouting for so many years, nothing had happened. My vocal cord never strained. But teachers, if they strain for 1 week, they are having very bad voice. This is because of speaking while breathing from the chest and speaking while breathing from the stomach. Basically, the teaching for singers or teachers or C20s or politician or octaves or instructor speak while breathing from the diaphragm. So this is a small art we used to teach each and everyone, even the singers. If you want to have a lifelong singing experience, older age, your voice is lost. It is not so much sweet as you sing earlier days because only one effect. You are singing from the chest or from the diaphragm or in the neck. If you move your shoulders, then you have lost your voice. That can happen when you stand and talk only. So for that, you have to lie down flat and train your voice. When you lie down and breathe, automatically your abdomen moves up and down, synchronized with your breathing. When you take a breath, the abdomen will move out. When you breathe out, the abdomen will go down. This you can see automatically if you put a hand on your stomach. This is very prominent when you are lying down and talk or sing. So that is a complete relaxation. This we want to treat many cases of puberphonia, especially in cases of tension larynx. So, good condition is there. Nowadays, in tension larynx, they are putting injections to relax the muscles. But happily, we can treat with knowing how to breathe abdominally and talk. So, we are now focusing mainly tension larynx and speech. Very easily we can treat it. So this condition is also very much now available. How to reduce tension of the larynx, laryngeal tension reduction techniques. So the role of musculoskeletal tension, and we can do some exercise and make it this type of dysphonia. So laryngeal musculoskeletal tension can be relieved by our simple method. A lot of other good treatment is also there, but our treatment is very simple and effective, because nowadays bottles injection they are putting, definitely it will be working good, but the treatment period is very repeatedly we have to do it. For muscular tension dysphonia, MTD. Muscular tension dysphonia is one of the most common voice disorder. It occurs when the muscles around the larynx, voice box, are so tight during speaking that voice box does not work effectively. Muscle tension dysphonia is more prevalent among 40 to 50 years age group. It occurs in female also. So mostly we are seeing this muscle tension dysphonia in male. So some politicians, they'll be able to come and tell, release the tension, such as massage, acupuncture, psychotherapy, physical therapy. At the same, you can receive voice therapy. But it needs multiple sessions to help the reduce muscle tension pattern. Yes, muscle tension dysphonia is very much treatable. They have done a lot of research on muscle tension dysphonia. It go away. There are feeling that there is no cure for this condition. But speech therapy or psychological therapy, they attempt Botox injection, which somebody says this is the gold standard treatment. We will continue with the treatment next Saturday. Thanking you very much. Great. Followed by, we'll have a small hot talk on Tamil literature and dysphonia, which is our term is puberphonia. Okay. So thank you very much. We'll wait. Great.